Hello, this is Calvin Spooler, and in this video tutorial I am going to be going over the scanning utility found in Universal Manager. All of our catapult stations have been configured with a scanning tool, which you can see right here. And this tool can be found both on the Scheduled tab as well as the Online tab. And it provides us with a way to add documents and images to studies in PACS. If for some reason you do not have the scanning tool on your station, please give us a call on the PACS line at 406-751-4299 and we'll get that added in there for you. So to start with, I will go over using the scanning utility while on the Scheduled tab. And later on in this tutorial I will go over using the scanning utility while on the Online tab. And we'll talk about some of the differences between the two. As you can see, I have two exams scheduled on our test patient. In order to scan documents into an exam, we must first select the exam from the work list and then click on the scan icon at the top of the screen, which brings up the image import dialog box. Now, there are three different ways that we can acquire images at this point. We can scan a document with the scanner. We can copy a file from the hard drive on our PC. And we can also copy from the clipboard on our PC. But before we do any of this, we need to make sure the utility is set up the way we want it. And for that, we're going to look first to the scan parameters box located right over here. So at the bottom you can see select source. What this does, if you had more than one scanner attached to your PC, you could select which scanner you wanted to use right here. But most of us are only going to have one scanner set up with our PC. So usually you're not going to have to mess with that. So I'm going to hit cancel here. Next up we have capture format located right here. By default, it's always going to be selected to monochrome, which is going to be appropriate for most scanning situations. However, sometimes you might want to scan something in color, and in that case you would select color. Sometimes you just want it to be black and white, like many documents could be scanned in just plain old black and white. But monochrome is going to give us a nice grayscale. And so especially if you were going to be adding like non-DICOM compatible images such as like a chest x-ray or a ultrasound image or something like that, you would want to use monochrome, and it defaults to monochrome, so usually we just leave that alone. Next up we have the resolution, which is in dots per inch. The higher you go with this, the longer it's going to take to scan your document. So this is set at 100 by default, but if you want a really awesome detail, you could take this up to 600, and it's just going to take a few more seconds to scan that document. The final setting we must consider before we go ahead and start scanning a document has to do with the way the document displays when viewing a study. If I were to scan a document with the current settings, the series designation would be open. As you can see here, which means that to view the document, or more importantly for a radiologist to view the document, it would be necessary to click on the document icon located at the top of the screen to open and view the document or image. So from outside of an exam, if we were right here, let me close this, we could click on the documents, and there are no documents associated with this exam, so we can't see any. But if we scan them in the open series, then clicking on that would allow us to view those documents. Also, if we were inside of an exam and we clicked on the documents icon, it would bring up an additional window allowing us to view the document. Problem is, a radiologist might not click on that all the time. And so sometimes we like images to be displayed as a series within the study that doesn't require going and looking anywhere else for that document. So let's open up the scanning utility again. So if I want the image to appear as an additional series within the study that is visible to the radiologist without clicking on the Documents icon, I need to change the series from Open to Radiologist, to the Radiologist preset, which is done by clicking on the Select Series button and then selecting Radiologist. And notice when I do that, the doc image type changes from Open to Medical. And if I click OK, it's going to add that series to the list of available series down here in this little field. And so now, since I have this highlighted, Radiologist highlighted, when I hit Scan, it's going to scan the document and display it as a medical image, just like if you were viewing a chest X-ray. So if I click on Select Series again, you can see it's Open. If I select on Radiologist, it goes to Medical. But another way you could use this is say you had a consent form that you wanted to scan in, and you want it to be displayed within the study as its own series that was viewable to the radiologist without them having to click on the Documents icon. You would do that by clicking Select Series, type in the name of the series that you want to add. And so let's go consent form. Then we would change this to medical so that it would be displayed as if it were a medical image. Hit OK, and it's going to add that series down here. So whatever you have highlighted down here, that's the series that the image will be scanned into. So let's just start with the default one, Open. I have a image in the scanner. We're going to go ahead and scan that. It's going to go ahead and do its thing, and there it is. There's our scanned image. I'm going to go ahead and select a different series. We'll go with Radiologist and then just scan it again. We'll go ahead and change the resolution to like 600 and hit Scan. And you'll notice it's going to take a lot longer to scan the image because it's going to get some super fine detail. So I don't recommend this for production setting where speed is of the essence. Probably not going to want to use that very often. Okay, so we've scanned that one into the Radiologist series. Last one, the consent form. We'll go ahead and highlight that series, and I'm going to change this back to 100 so we get a quick scan. Hit Scan. It's scanning. There we go. So we have one image in each series. If you'll notice, when I click on this Radiologist series, the arrow buttons are grayed out. That's because there's only one image in each of those series. Now if I want to put more than one image into a series, that's fine. You just select the series, hit Scan, and now in the consent form series I have an arrow that's not grayed out because, although you can't tell other than the fact that it says image 1 of 2, there are now 2 images in the consent form series. If you click on the Open, there's one image of 1, Radiologist 1 of 1. So that's kind of how you do that. Key is, if you want it to be viewable to the radiologist without clicking on the documents, you need to make sure you go in here to the Select Series and select this Radiologist preset we have in there, which will switch it to a medical image that will be displayed just like an X-ray or anything else. So let's just cancel that. Talk about some of the tools, and these tools should be familiar to you. We have the window level tool. We can window level our images. The magnification tool if you want to zoom it up a bit. I don't know why you would use this magnification tool, but it's there. You can invert the image. You can crop the image if you want to get rid of some stuff, make it a little bit prettier. Preview the cropping for this image. Now of course it's all zoomed up because I've zoomed in, so I'll zoom back out there. There's also orientation. You can flip it. For all of these tools, if you select the tool and then give a right click to the image, you'll get a shortcut menu that drops down. So for the image orientation tool, it's set to mirror right now. But what if I want to rotate or flip? You just give it a right click and select what you want to do, rotate. So that's pretty basic. You could also delete the image. Say I don't want this one. Say, are you sure you want to delete the image? Yes. So now we have no images in the radiologist series. So I'll go ahead and scan one in again. You can pan things around with the pan tool if you're zoomed in. You can add markers. There's a lot of different ones you can put on there if you wanted to. Most of the stuff you're never going to use because most of the time you're just going to scan in a document, and that's going to be that. But you can put annotations on there if you want. You could even calibrate an image by clicking that tool and then clicking on your image. But like I say, this is stuff you're probably not going to do very often. There's a ruler tool, which it's gonna, if you try to use that, it's gonna tell you you have to calibrate the image before using it, which you do that once again by using the calibration tool. Lastly, if you have questions, you can always click on the question mark button. That'll bring up the DR Systems Help menu. You can try searching for an answer. So that's that. Moving on. That's pretty much scanning. If you don't want to scan an image, but you want to actually copy an image from a file, you can do that. This could be useful if you have a non-DICOM compatible modality. I know we have an ultrasound unit in surgery that it outputs the image as JPEGs, which you can't send a JPEG to a catapult. So if you have a file you want to copy, or maybe a PDF or something like that, just hit copy from file, and then you're going to have to browse to a file, select your file, and hit OK. So here we've imported Homer into our radiologist series. So right now in our radiologist series we have Homer and we have a smiley face. So that's pretty useful. Lastly, you can also copy from a clipboard. Say, I don't know why, but I'll just use something here on the internet here. So say I want to put Popeye here into a study. I would copy and get rid of this thing, and then I would go copy from clipboard, and there we go. I could also, if I select black and white, it's going to import that as a black and white. Monochrome should do the same thing, and obviously color is going to import it as color. So now we have 6 images in our radiologist series, and I don't like that one, so I'm going to delete that one and delete that one. So now we got Popeye, we got an extra Popeye, we got Homer, we got the smiley face. So that's that. You can also clear all the series images. Say, we don't need the consent form stuff, so I'm just going to get rid of them. Are you sure you want to clear all images? Yes. So now in the consent form we have consent form series, we have no images. You can also move series images. So I can come into here and be like, I need to move Popeye into the consent form. Okay, so now the consent form has Popeye, Open has a smiley face, Radiologist has Homer, and the smiley face. I don't want the smiley face in there, so I'm going to get rid of him. So now we're back to having one image in all of our series, like that. The other thing you can do is you can add any of your scanned in documents or images or whatever to other exams by clicking on the Add to Other Exams button. So you notice I have 2 exams scheduled for this patient. It's going to go out and look for other exams scheduled for this patient. Here it is right there, the spine cervical, and we are going to add visible image, or you can add entire series. You can just pick, oh, I only want that one, or that one, or that one, or whatever. You can pick and choose, or just do them all. So I'm going to say, let's go ahead and do those 2 right there. Save it. And we're done. Once you're done, you just hit save and exit, or if you decide you don't like any of that, you can cancel, obviously, and it won't save any of your work, but we're going to save and exit. So now we're going to come over here to the test patient and see if we got anything. You got no exams there, no documents. And for the open, on the other one we had the smiley face. So, but there's only one image in the open class. So I'm going to do something, since I don't have any x-rays that I actually have to go with these patients. There's another button up here. It's called the No Image button. And if you highlight an exam and click No Image, you can put just a scanned-in document online. So I'm going to put this online as red and click Yes. Okay, so that's online now. If I go online, there it is. And we can view it. There's Popeye in PACS. Isn't that sweet? And we have Popeye and Homer in there, but that's it. If we hit F12, we can see a list of our series. So there's a consent form series, there's a radiologist series, and if we close that out and we hit Docs, there's our smiley face. So that's that. I'm going to come back over here. We'll go ahead and say no image. We're going to put it online as red. Yes. Online. So now we have both of them on there. So now we have these online, and we remembered, I forgot to scan in the document. If the exam's already put to red, you're going to have a limited available options. So I'm going to go up here, I'm going to highlight the exam, and I'm going to hit scanned. And if you try to go to select series, it's not going to let you add a medical image, which means you're only going to be able to add images into the docs folder. And I think that's probably so you don't sneak one in on a radiologist. If it's put to red, you can't be adding images to a study. But you can attach a document, an attached document, which is what the open designation is for. So if you wanted to add an actual image to the study, or an actual series image, what you would have to do is, let's close out of here. We're going to mark the exam status on this exam to scanned, and then really quick, so a radiologist doesn't pick it up, I'm going to mark the exam status to hold for edit. Now if we hit the scan button and we go to select series, you'll see that it's just like it was before. So when you're on the online tab, if the exam is marked to red, you have limited options. Otherwise, if it's in scan status or hold status, you can just go ahead and select a series and go ahead and do what you need to do. Like say I wanted to come in here and go ahead and throw down a chest x-ray. Copy that bad boy. I want to throw it in the radiologist series. Copy from Clipboard. There it is. Save and exit. Now we could go ahead and view this thing. There it is. It's in there. So That's basically that. If you guys have any other questions, comments, and concerns, go ahead and let me know. PACS line 406-751-4299. Thanks for watching.